these kind of very esteemed patient who comes to us doing such complex surgeries in our hospital. This is a testimony of our hospital, which is how much trust a patient is putting on our hospital. This is not one or two people who are delivering this kind of services. This is last 20 years, this journey of SPARSH has been giving the best clinical outcome in India. You might have seen many of the stories which SPARSH has delivered so far in terms of various kind of specialty, various kind of surgeries. And at this age of 100 also, a patient who is coming to us for such complex surgery, this gives us a lot of inspiration, a lot of faith on ourselves, because at that age, most of the patient, even if it's in our family, we think about managing some more year with managing some pain, and somehow we want to pass some more years. That's how we think. But this family has been really contributing and putting their effort and trusting on us to go ahead for such surgeries, and giving good recovery. Also, it's very important for us to get the family's trust and faith and cooperation to deliver this kind of procedures. At this moment, I acknowledge everyone who are involved in this case, right from our people who are counseling the patient to our OT staff, our people who are supporting entire back-end services, along with definitely the surgical team and anesthesia team and post-surgical management. Everybody is really involved in this care. That is how at that complex surgery we were able to bring somebody like this today in front of you. I'm really grateful to all of them. And SPARSH as a brand, we continue to dedicate ourselves to give the best clinical outcome which is possible across the globe. We are trying to bring it to India with all the technology, all the clinical skills, all the infection control parameters, all kind of clinical excellence which is required to do such kind of surgery. We are really committed to do this. Thank you very much. I will allow our surgeons and the patient to talk about it further. Thank you very much.
Good morning. Welcome all to the printing and electronic media. I'm very thankful for you to be present here. So when I encountered a patient which is around 100 years last year, that when she had come with a very complex hip fracture. So then luckily the family people, they agreed for the surgery. We had counseled very well. I explained them the complexity of this surgery. So with that age and kind of fracture, it's very difficult to manage in small hospitals like that. So now we are well equipped with that, whatever complexities we come across. So we counseled the patient very well. Because of her age, she had a lot of comorbidities, osteoporosis and osteoarthritis. And even our intake was a little less compared to the younger age group. When you compare to the younger age group, the older age group, they have a lot of other problems like loss of muscle mass, then osteoarthritis, bone loss. So because of this bone loss, they have even severe trivial fall, just a fall, slip and fall. They will have fractures. So we have to take care of all those things. Then we counseled for the surgery, which is a very complicated. So as a fracture itself was a very complex fracture because the comminuted femur fracture. The femur is very weight bearing, which allows any patient to walk. But with the fracture, they will not be able to walk. If we don't treat them at the right time, so they will be bedridden. So there are other complications of lying on the bed for a longer period.
And post-operative pain is another part. If these things we taken care, most of the complications are handled better. So that one we have done. And as per as our concern, the age is merely a number. The advanced age or the number of complexities or comorbidities or the issues they are having, that should not deny a person their right to mobility and independence. And as a team, we are proud to be part of her healing journey and wishing her a healthy, happy and life.
And I'm also a hardware VLSI design engineer by profession, several years in US. So I'm speaking about mom, Lakshmi Bhargav, but first I will say she was 98 years when the surgery happened, and Dr. Shravan Patil and Dr. Venugopal both were there at the surgeons there. And Dr. Venugopal was referred by Shanti David, who was my neighbor. She was also 86.
83.
And doctor operated her successfully, and we saw her walking. So we were very confident that what doctor is going to do is something similar to Shanti ma'am. When he looked at the X-ray, I think he said the replacement was needed, and was very concerned about the age. And Dr. Thiru about the anesthesia part. He convinced me that the anesthesia is going to be from bottoms down, the spine one.
Spinal anesthesia.
Not the full. So I was concerned with Dr. Thiru. So he convinced me, no. She will be very awake. She will actually, and one of mom's comments was, somebody is actually hammering. That was one of her comments during the surgery, because the bone has to be hammered in, and he was doing it. मैं बता रहा हूँ आपकी सर्जरी के बारे में, फिर आपको मौका देंगे बोलने का। आपकी सर्जरी के बारे में।
ये लोग डॉक्टर्स हैं क्या?
ये प्रेस है, ये डॉक्टर्स यहाँ आपके बाजू में।
अब क्या होगा? अभी कब की सर्जरी होगी?
One of the things I want to see, say one of the things about the ICU. When mom's surgery was complete, Dr. Venu came to me and said, you need to speak to her. I said, doctor, she's in the OT. Are you sure? And then Dr. Shravan Patil was also there. So they called me, they dressed me up in the surgeon suit, put all the things, shoes, and actually walked me inside the OT. So this was very good experience. I think this is one of the best favor that doctor has done.
ಒಳ್ಳೆ ಸಾಧನೆ ಅನ್ಬೋದು. ಅದಕ್ಕಿಂತ ಹೆಚ್ಚಾಗಿ ನಮ್ಮ ಸ್ಪರ್ಶ್ ಹಾಸ್ಪಿಟಲ್ದ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಏನಿದೆ ಅಂದರೆ ಇಲ್ಲಿ ತನಕ ಮಾಡಿರೋಂಥ ಸರ್ಜರೀಸ್ ಆಗ್ಬೋದು, ಯಾವುದೇ ಆಗ್ಬೋದು, ಎಲ್ಲದರಲ್ಲೂ ಸಕ್ಸಸ್ ಆಗಿದ್ವಿ. ಅದು ಇದು ಒಂಥರ ಎಕ್ಸೆಪ್ಷನಲಿ, ಬಿಕಾಸ್ ಅವ್ರದ್ದು ವಯಸ್ಸು ಜಾಸ್ತಿ ಇರೋದ್ರಿಂದ ಸ್ಪೆಷಲ್ ಕೇರ್ ತೊಗೊಂಡು ಎಲ್ಲ ಬೇರೆ ಬೇರೆ ಡಿಪಾರ್ಟ್ಮೆಂಟಿಂದ ಇನ್ಪುಟ್ಸ್ ತೊಗೊಂಡು ಚೆನ್ನಾಗಿ ಸರ್ಜರಿ ಮಾಡಿ, ಪ್ಲ್ಯಾನ್ ಮಾಡೋದು ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಚೆನ್ನಾಗಿ ಪ್ಲ್ಯಾನ್ ಮಾಡಿ ಸರ್ಜರಿ ಸಕ್ಸಸ್ ಆಗಿದೆ. ಅದು ಈಗ ಇಷ್ಟು ದಿವಸ ಆದಮೇಲೆ ಇನ್ನೂ ನಡೀತಾ ಇದ್ದಾರೆ ಅಂದರೆ ನನಗೆ ತುಂಬ ಖುಷಿ ಆಗ್ತಾಯಿದೆ. ಸೊ ಅದರಿಂದ ಸ್ಪರ್ಶ ಏನೇ ಇರಲಿ, ಯಾವುದೇ ಕಾಂಪ್ಲೆಕ್ಸ್ ಆಪ್ರೇಷನ್, ಫ್ರ್ಯಾಕ್ಚರ್ಸ್ ಆಗ್ಬೋದು, ಕಾಯಿಲೆಗಳಾಗ್ಬೋದು, ಬೋನ್ ಮೂಳೆಗೆ ಸಂಬಂಧಪಟ್ಟದ್ದು, ಎನಿ ಟೈಮ್ ಯಾರು ಬೇಕಾದರೂ ಬಂದು ಇನ್ನೇ ಸಹಾಯ ಪಡಿಬೋದು. ಬಂದಾಗ ನಾನು ಡೆಫಿನೆಟಾಗಿ ಅವ್ರದ್ದು ಸ್ವಲ್ಪ ನೋಡಬೇಕಾದಾಗ ಅವ್ರದ್ದು ಪರ್ಸ್ನಾಲಿಟಿ ತೆಳುವಾಗಿದ್ದರಿಂದ ನಮಗೊಂದ್ಸಲ ಎಲ್ಲೋ ಮನಸ್ಸಲ್ಲಿ ಡೌಟ್ ಇತ್ತು. ಆದರೆ ಅವರು ನೋಡಿ ಅಸೆಸ್ ಮಾಡಿದ್ಮೇಲೆ ನನಗೆ ಧೈರ್ಯ ಬಂತು. ನಮ್ಮದು ಎಕ್ಸ್ಪರ್ಟ್ ಆಲ್ರೆಡಿ ನಾವು ಈ ಥರ ಕೇಸಸ್ ಮಾಡಿರೋದ್ರಿಂದ ನನಗೆ ಧೈರ್ಯವಾಗಿ ಆಪ್ರೇಟ್ ಮಾಡಬೇಕಾಗಿತ್ತು. ಮುಚ್ಚೆ ಇನ್ನೊಂದು ಪೇಷಂಟ್ ನಾನು ಹೇಳಿದ್ನ ಹಾಗೆ ಕೂರ್ಗಿಂದ ಬಂದವರೊಬ್ಬರು ಹಳೆ ಹಾಸ್ಪಿಟ್ಲ್ ಇರಬೇಕಾದ್ರೆ ಅವ್ರದ್ದು 100 ವಯಸ್ಸು. ನನಗೂ ಅವ್ರದ್ದು ಇದೇ ಥರ ಇತ್ತು. ಅವರು ಶಾರ್ಟು ಥಿನ್ ಆಗಿದ್ದರು, ಬಟ್ ಹಿ ವಾಸ್ ವೆರಿ ಆ್ಯಕ್ಟಿವ್, ಮೆಂಟಲಿ ಹಿ ವಾಸ್ ವೆರಿ ಆ್ಯಕ್ಟಿವ್. ಸೊ ಹಾಗಾಗಿ ಅವರು ಮಾಡಿ ಆಪ್ರೇಷನ್ ಮಾಡಿ ಆರಾಮಾಗಿ 3ನೇ ದಿವಸ ಹೋದರು. ಹಂಗೆ ಕೂರ್ಗೆ ಹೋದರು. ಅಲ್ಲಿ ಕೂರ್ಗೆ ಹೋಗಿ ಕಾರ್ ಡ್ರೈವ್ ಮಾಡ್ತಾಯಿದ್ರು ಸಿಂಗಲ್ ಆಗಿ. ಹಿ ವಾಸ್ ಮ್ಯಾನೇಜಿಂಗ್ ಆಲ್ಮೋಸ್ಟ್ 500 acres ಕಾಫಿ ಪ್ಲಾಂಟು. ಆ ಥರ ಈ ಥರ ಚಾಲೆಂಜಿಂಗ್ ಕೇಸಸ್ ಮಾಡಿ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇರೋದ್ರಿಂದ ಒಂಥರ ಖುಷಿ ಆಗುತ್ತೆ.
ಲಕ್ಷ್ಮಿ ಅವರು ಇವತ್ತು 100ನೇ ವರ್ಷದ ಕೇಕ್ ಕಟ್ ಮಾಡಿದ್ರು.
ನನಗೊಬ್ಬರಿಗೆ ಖುಷಿ ಆಗ್ತಾಯಿದೆ. ಅವ್ರ ಜೊತೆ ನಮ್ಮ ಒಂಥರ ಭಾಗ್ಯ ಅಂತ ಹೇಳ್ಬೋದು. ಆಮೇಲೆ ಕೇಕ್ ಕಟ್ ಮಾಡೋದಕ್ಕಿಂತ ನಾವು ಹಿಸ್ಟ್ರಿಯಲ್ಲಿ ಓದ್ತಾ ಇದ್ವಿ, ಏನೋ ಮಹಾತ್ಮ ಗಾಂಧಿಯವರಾಗ್ಬೋದು, ಸಾವರ್ಕರ್ ಆಗ್ಬೋದು, ಈಗೇನು ಓದ್ತಾ ಇದ್ವಿ. ಅವ್ರ ಬಾಯಿಂದ ನಾವು ಕೇಳೋದು ಈ ಥರ ವೆರಿ ರೇರ್ ಟು ಹ್ಯಾಪನ್, ವೆರಿ ವೆರಿ ನೈಸ್ ಹ್ಯಾಪನ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್. ಸ್ಪರ್ಶ್ ಹಾಸ್ಪಿಟಲ್ ಕಡೆಯಿಂದ ಅವ್ರಿಗೆ ಕಂಡೀಷನ್ ಅಂದರೆ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಅವ್ರು ಈ ಥರ ಫ್ರ್ಯಾಕ್ಚರ್ಸ್ ಆಗಬಾರ್ದು, ಬಟ್ ಆಗುತ್ತೆ. ಆದರೂ ಸಹ ಭಯಪಡೋಂಗಿಲ್ಲ. ನಾವು ವೆಲ್ ಎಕ್ವಿಪ್ಡ್, ತುಂಬ ಎಲ್ಲ ಸ್ಪೆಷಾಲಿಟಿ ಇರೋದ್ರಿಂದ ಬಂದು ಆರಾಮಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಂಡು ಚೆನ್ನಾಗಿ ಹೋಗ್ಬೋದು. ಆ ಥರ. ಥ್ಯಾಂಕ್ ಯು. ಡಾಕ್ಟರ್ ವೇಣುಗೋಪಾಲ್ ಅಂತ ಚೀಫ್ ಸರ್ಜನ್, ಇವರು ಡಾಕ್ಟರ್ ಚೇತನ್ ಅಂತ, ಇವರು ಡಾಕ್ಟರ್ ಶಶಿಕಾಂತ್ ಅಂತ. ವಿ ಆರ್ ಟೀಮ್ ಇನ್ ದ ಹಾಸ್ಪಿಟಲ್, ರೈಟ್?